everyone, I'm Troy.
And I'm John.
And we're back again for another video for the 2018 running medicine spring season. And today we're going to talk about a couple of the common running injuries of the ankle and foot, including some signs and symptoms and even some management techniques.
That's right, Troy. Today we're going to talk about Achilles Tendinitis and Plantar Fasciitis. Why don't you start us out with Achilles Tendinitis, Troy?
I'd love to, John. Achilles tendon injuries are actually on the short list of some of the most common running injuries. The Achilles tendon is the tendon that attaches the calf muscles to the heel of the foot. Achilles tendon injuries can be caused by a number of different things, including ankle or calf stiffness or tightness, abnormal biomechanics while running or walking, improper footwear, and even overuse.
Some of the common symptoms include tenderness of the heel or along the Achilles tendon, tightness in the ankle or calf, swelling in the back of the ankle, pain in the back of the heel, and or pain stiffness with walking, which is worse with the first several steps.
So if we experience this injury, how do we manage it?
That's a good question, Troy.
Well, I'll tell you. Initial management includes rest and activity modifications, so you will want to run only until just before the pain comes on or increases significantly. Additionally, while in the acute phase and early stage, you will want to follow the PRICE method. PRICE stands for protection, rest, ice, compression, and elevation.
After you have the pain consistently under control, treatment should be focused on strengthening the integrity of the Achilles tendon. This can be done by progressive eccentric loading exercises, which can consist of slowly lowering your feet from the plantar flex position down to the ground. Slowly add weight as you progress.
Lastly, you'll want to introduce calf stretches into your normal routine, which you want to hold a light to moderate stretch for 3 to 5 minutes on each leg.
Wow, Troy, that's some great information. All right, next we're going to quickly talk about plantar fasciitis. So, the plantar fascia is a layer of tissue on the bottom of the foot that extends from the heel to the ball of the foot. It serves as a stabilizer for the longitudinal arch of the foot. Plantar fasciitis is caused when the tissue becomes irritated or inflamed. This can be due to many different reasons, such as overuse, overpronation, such as a flat foot, starting a new running program, and decreased calf muscle flexibility.
Common symptoms include heel pain, which is worse in the morning, specifically during the first several steps of the day, prolonged standing, when standing after sitting for a while, after running, when climbing stairs, and barefoot walking or walking in shoes with poor support.
Now, management for the plantar fasciitis is actually pretty straightforward. Studies have shown that passive plantar foot stretching programs provide the greatest success in improving pain and has a great long-term effects. The stretch can be completed by using one hand to passively extend the toes towards the shin until stretching sensation is felt along the arch of the foot. Hold this stretch for 10 seconds and for a total of 10 reps 3 times a day. Additionally, other techniques such as massaging the foot with the golf ball and rolling your foot over a frozen water bottle can provide some pain relief.
Awesome. Thank you so much, John. And that's it for today, guys. Keep an eye out for our next video.
See you next week.